I think how many center use they how to use your technique in the European?
But
I hope each of us trying to be your center.
yeah, I don't understand because the voice go down and up. So our technologies is very easy because I think that is enough a PC, a tablet, and an application into the metaverse or other application for the virtual reality. In this case is a spatial application. And after we can connect this application with the console, robotic console or laparoscopic column, and we can sharing the images and the surgery field to project this every surgery step.
Sorry, Professor, because he
I
couldn't
think
hear the question exactly. So the work that are in Italy, it is under the supervision of the Metaverse Surgical Hospital. So I can answer this question. The University of Magna Gracia Teaching Hospital is one of the hospitals that have our technology. The Hospital of Mayuli in Rome, also one of the hospital, and the Memorial Hospital in USA. These hospital, their surgeon participated in our workshops, and after that, when they returned back to their hospitals, they were supplied with the technology and the training. So this is how, example, the surgeon come to the workshop. After that, they are trained. They are seeing how to get the technology to install the program in their smartphone, and after that we connect together, we make a training session, and after that we open a branch in the hospital for our work. So this is how we are doing it. Yes, because he didn't hear you. This is why he didn't answer the exact. Yeah.
I think that today metaverse is important for different option in the medicine and in surgery. And I think that the first option to use metaverse is the condivision, the possibility of to share clinical information, all clinical information on molecular or other important clinical information of the patient to offer to the patient the best care from different opinion, from different specialists into the world. And I think that today is the first important use in the world for with the metaverse. Another important option is sure the possibility to do surgery with different indications. So for the telementoring, that can be or oral or practical telementoring in robotic or laparoscopic surgery, and I think that is another important option of the metaverse today in surgery, but I think all in the health in general, in medicine. It's clear that there are much more options that I think that work in progress to establish it in medicine and precise treatment or a precise treatment or precise option to care the patient. But I think that today telementoring, second opinion, and support for example, in diagnosis is very, very important.
Yes. We are having one question here. So can you hear my voice is clear, dear audience?
Yeah.
Your
yes. Voice is clear,
so,
yeah.
There is one question. How can AI assist in the precise diagnosis of surgical oncology? And of course, as we said in our lecture, from the early screening programs, from the radiology supplied with AI, whether MRI or CT scans or ultrasound supplied with AI, now the new technologies, these can detect, example, the early diseases in order that we can put a plan, and you can see in the news that AI was able to diagnose a breast cancer from mammogram 5 years before it occurred. So imagine when he saw a suspicious lesion, okay, he gave an alarm that this lesion can go to a malignancy, so it's better to treat it. And this is one of the cancer screening. So this is an answer for how can AI help us. Another question is that how can AI assist in the precise diagnosis of surgical oncology? We answered about this question.
There is another question from other platforms. And the second question is, can large language models assist in generating personalized tumor treatment recommendations? So,
Yes.
do you have
Of course,
any suggestions?
the nice thing that AI will help us is something that will go to personalized medicine and surgery, which means that I have three patients. Each patient will have a surgical plan which differs from the other patient. And this is which is called personalized medicine or personalized surgery. AI can assist in this. How? He can take the tools, example, the size of the tumor, the age of the patient, the associated diseases, and all of that in order to put the plan which is safer. So example, we are having two patients having pancreatic head tumor. One is 50-year-old, the other is 80. The one with 50 is fit for surgery. We can go for robotic Cooper to save his life. The other for 80 is having cardiac diseases, diabetes, hypertension, and CVA. So in such option, laser ablation will be the option. So this is what is meant by personalized surgery. It is a new advance of surgical era with AI technology.
I think also for the postoperative rehabilitation, we can do a plan. Yeah, we can because we can give to the patient a program that we can follow during the period during the postoperative period. We can follow with a meeting with your life in the after postoperative period.
And let me tell you a real story about the rehabilitation. There was one patient in Europe who operated a tumor from non-Hodgkin's lymphoma in the neck. And after that, the patient was in a bad psychological upset. So what we did, we sent our avatar to his home in the post-operative care. And he was happy because this avatar was answering his question. And also he was doing psychological support. So as I told you, in the surgical oncology program, from the screening, intraoperative, preoperative, postoperative, and even rehabilitation and postoperative care, that the avatar, the metaverse, and the AI can help us to get better results.
Yeah, because we can keep in touch with the patient after in the period in the postoperative period. It's clear that before we can write a program for the patient, I think decided that
yes. Other important thing, actually, listen to the, usually these patients stay in the hospital for 14 or 15 days, surgical oncology, and sometimes they are having comorbidities and a lot of diseases. So what we are doing, we succeeded to decrease the expenses of the patient about 80%. And we were sending our patient home 2 days after operation, and after that he is entering in our Metaverse hospital inpatient, in which he is supplied with a visit of a consultant surgical oncologist according to the specialty, time visit, every day, daily visit, evaluated, seeing his vital signs, blood pressure, temperature, pulse rate, and also the home care. And we succeeded to get an amazing result. And instead of keeping the patient for 20 days in the hospital, we are discharging this patient, and by AI and avatar and metaverse programs, we succeeded to save life and interfere with early complication and treat it. And this is another advantage of the AI and metaverse in surgery.
Thank you. Thanks for your response. So for the second question, actually, we would like to invite Professor Jiexin He to give us some suggestions regarding the second question. Hello, Professor He. So could you give us some suggestions about the second question? Can large language models assist in generating personalized tumor treatment recommendations?
Yeah. Why we developed this the granular model for the MDT is very important. The granular model, oh, that's like the Superman. They have too many that information and data. Maybe just for some specialists, maybe I think not the database or in the for some doctor. Maybe because the human, I think the database are not so big. So use grand language model be just like we use the Quark 4 and use the GPT 4.0 and use let's use the Jimmy and combine together and very helpful for the with the doctor very good together. They give the totally, give the conclusion and give suggestion and more the completely from the system systematic and from not just for the give some just like mechanical from the target therapy from how to support the patient and they will consider the very more than the doctor, the human.
Thank you. And there are two other questions from the answer part from Wang Runchen. His question is, as AI and metaverse technologies generate vast amounts of sensitive surgical data, what global status should be established to ensure interoperability, privacy protection, and equitable access? So could you give some answers for Dr. Wang Runchen?
As I told you, gathering data all together. So this is why I feel happy today to see the work of China, and of course I'm following the work and the work of Europe, the work of USA. So exchanging knowledge and collecting data, and also legalization, making illegal aspects in dealing with these data, and also, as I told you, the human control. So I hope everyone, there will be the human control on this, because these robots will reach a state that they can operate by their own using the data. Even the operation that the professor showed for cutting the tattoo of the lung tumor, if a robot system can trace these tattoos, example, if they are has a memory and machine language, he can do the surgery by its own. But of course, it's safer always to put a human control. So collecting more data, of course, the combination of the metaverse. Do you know that we participated in saving the metaverse because Meta company saved billions of dollars on the metaverse, and they in the early stages they thought they failed. But after the success of our hospital and what we did, we started to publish work, and we were the first to combine the artificial intelligence with metaverse in healthcare. So this was one of the successes of the metaverse in healthcare. And when we put AI with it, and this is why we can go all together forward for more success.
Thank you so much. Thanks for your answer. So Professor Amendola, there's another question we would like to invite you to answer this one. Do you think AI and the metaverse will mainly serve as assistive tools for surgeons, or could they fundamentally redefine the surgical paradigm?
No. I think that the metaverse is very, very important for this normal surgery. But I would like to underline that the very important feature of the metaverse is the possibility to evaluate the evaluation of the patient in multidisciplinary way. So we can offer the best care to the patients and to the disease of the patient. This is, I think, the very important revolution, but this is the very important feature of the metaverse. But For the rest is I think that medicine is the same, and in this way, with these new technologies, in particular with the AI and metaverse, we can improve all aspects, from diagnosis to treatment of every disease, in particular in surgery, but other disease in other fields of the medicine. In particular, I don't know, for example, radiology, for the diagnosis aspect, or radiology interventistic treatment. So I think that with this new technology, we can improve some aspect of the medicine, but I think that the medicine and surgery that remain the same of all time. And another important thing, I think that today the medical aspect, the problems are overcome, because in all hospitals over the world, the data of the patient are in informatization model, are in informatic instrument. So I don't see the difference with the other problems. So certainly the data will be shared in the world, but this is the clinical practice of today in all hospitals over the world. So I don't see a problem.
It's an honor to have your presentation here, and it's amazing to see your presentation with nice metaverse studies. So, as surgeons, we will have some questions, because if we use the metaverse technologies during the surgeries, we have to put on devices to our ISIS before the ISIS. So it's a large device. So do you think it's maybe make a little bit inconvenient for doctors to do surgeries, or to make the physicians more difficult to communicate with patients face to face? So although it is very good tools to make the decentralization medical things, but it's still some obstacle stuff. Do you think so?
Yes, Professor. Thank you for your question. Actually, time by time, these devices are getting smaller, okay? And of course, even smartphone is more than enough. So example, the avatar telementoring that we are using now to telementor surgery, which is supplied with AI, is on the smartphone, the smartphone has the system program, and you can activate the augmented reality option. After that, you will see the avatar inside the operative theater. So only you need, and of course, when the surgeon is sterilized, usually my assistant activate the mobile and on, and I can see the avatar on my right side, or I can use the headset, and you can see that time by time, these headsets are becoming smaller and cheaper and more affordable.
It is all inside the application of virtual reality application. So in this case, we use spatial application for virtual reality, but there are other applications that you can use. And into this application, there are in the menu, there are the all option for mixed reality.
So only we need an active Wi-Fi in this operative theater. So example, in any hospital, and even if you don't have a robot, no problem, even laparoscopic surgery, this is what we are doing now with Africa. And as you know, not every hospital have a robotic system. So even if you have your laparoscope, we can do, even if you have a classic surgery, we can do the telementoring and avatar and metaverse surgery.
Professor, it's my honor to hear your presentations. It's really amazed. My question is, I'm really interested in the virtual hospital. So how do you recruit patients for the virtual hospital, since the physical hospital system is already very mature? So how do you recruit patients for the virtual hospital?
Yes, I will tell you. Actually, we are, as I told you, one of the advantages, we are saving time and money. So what we are having now, an international patient who is booking, example, in UK or in USA, and they're booking with a specialist consultant will come after 3 months or 4 months. So what they do, you tell me. In our hospital, the booking is 3 to 4 days. Okay, this is one. So we are saving time here and also saving money. Even the consultation fees, okay, is about 30 or 40% less than the original fees in these countries. So we save time, we save money, and even we are putting more technology. You can see that we are putting advanced robots, we are putting satellites, telesurgeries, we are putting laser ablations, we are putting avatar surgeries and avatar telementoring and advanced AI program. So this is why the patient is clever, okay, and he will choose what is the best option that can save his time and money. So this is why patients are choosing the Metaverse Surgical Hospital in order to be treated. And of course, our distinguished international professors in all specialties, we are having even our organ transplant unit, our stem cell therapy unit, our advanced AI units, our screening units, and so on. And even our space telemedicine, and it is the only hospital which has the space telemedicine and telesurgery system, which is connected with satellites and provide the primary healthcare to the space station and the space exploration missions. Yes.
Thank you.
Yes,
Thanks for.
because we today can think about an international waiting list of patients. So we can now book our hospital, our specialist, our surgeon to treat our disease.
And even
So,
my message to the governments that this will help to solve the collapsing health program, health issues that many countries, without names, I will not give names, many countries now are facing an existing issue in health crisis, okay, because of the load of the patient and the limited abilities of the hospital. The nice thing in the metaverse that it is an open space. Okay, so you don't need an office, you don't need the paramedics or the secretary. Imagine one secretary. I'm having my real secretary. Sometime I give her duties to go to receive the patient, and of course we are receiving emergency, and also we are receiving elective cases.
Yeah. Thanks for your answer.
Okay. Okay, since we are all thoracic surgeon, and so we are more interested in the aspects of surgery. So I'm just wondering, what role do you see for the Metaverse platform in remote surgery? Will it truly be enables global collaboration between surgeon or surgeries, or which what kind of surgery will it benefit most? Maybe the minimal invasive surgery or complicated surgery like transplantation or other surgeries, and what kind and what do you think?
Yes, actually, the advantage is, as I told you, the virtual reality guided robotic arms. It's an amazing. So, example, you can see it even in my YouTube channel. I put the headset on, I activate my arm controllers, and I connect with the robotic arms. And after that, I can control the robot 100% from distance, whether between Earth and cities in Earth or in the space. So, this is one of the advantages of telesurgery, which is a real mixture of metaverse and surgery, which is the avatar or the virtual reality guided robotic arm. This is one. Number two, the avatar telementoring. I told you, example, you are having a rare surgery, so you can, in one click, instead of the surgeon coming and buying a ticket and hotel, in a matter of minutes, he will be like an angel on your right side, okay, and he can do visual telementoring, and he can give you his experience, example, to tell you what to cut, example, do bypass, mini bypass, raw and Y, or the option of surgery, or the secondary opinion. So this is the other advantage. And also in the 3D reconstruction, let's say we are having a complex surgery, an organ transplant, as you said. So example, I do a 3D reconstruction before the surgery, example, let's say in the night of the one day before. So I can see that there is a congenital anomaly of the hepatic artery or the hepatic veins. So I can be ready to prepare a graft or to make an option so that my surgery time will be less and also less complications. So you can see there are many advantages. And of course, in the space, we proved the advantages. You know, sending people to the moon and to Mars is very dangerous. So for me, whenever there is a Wi-Fi, I send my avatars, whether doctors or surgeons supplied with AI, with the robotic arm, I can provide an advanced healthcare or surgical care plan to Mars or moon or even to the International Space Station. So this is why you can see it's an amazing technology. And of course, time by time, it will be developed more.
Yeah. Okay, I see. And so it brings a convenience not only for doctors but also for patients, and it's a very good platforms. And maybe we will discuss more, or we can collaborate more in the near future. Yeah, thank you.
I have a question to ask you. Let me see it. Uh, Metaverse is an important technology, but I have a question. Can the Metaverse technology can fully replace the traditional hands-on practice in surgical training? Why or why not? If or not, what the difficult challenges do you think?
The, the, no, there isn't a particular change, but the very important is the telementoring in training for young surgeons. So during the surgery, you can discuss with your head with a senior surgeon that can give you some indication about the surgery. So the training curve can improve in this way with suggestions from different specialists that are different from the young surgeon. And in this case, the training is, I think that it's better now, no?
Okay, thanks for your answer.
Yeah, that's all questions from our team, and many thanks from both professors, and gave us very fantastic answers and the presentation. Thanks you again.
I want to thank you, to thank our speaker. I want to thank Yaxing He for amazing presentation and the use of AI in thoracic surgery. I want to thank Professor Mohammad Ansari for amazing presentation about our collaboration. And I hope to upgrade this collaboration, this scientific collaboration with new technology in the field of new technology in surgery, particularly in Metaverse, because I think that will be the future of the surgery, but not only for the surgery, but the future of the medicine. And in general, I think that from diagnosis to the treatment of all disease, and also in other fields, so in preclinical fields, for example, in biology, in molecular biology, I think that AI and Metaverse can be changed some aspect of the medicine.
Okay. And the surgery is already so exciting and challenge the medical practice. I think how to call the modern surgery a modern surgeon, and even important, we had to use the modern technique combined together. For now, the AI, the grand language model, and the robotic is the modern technique. So we had to training our genius generation to use the AI to be the assistant to help the surgery become the modern surgery, not just like the before, and then maybe the laparoscopy, another just the ongoing, but coming future, the planning, the use of AI to help us to let the diagnosis and our therapy more and more precise, and maybe more and more foolish, and one step will be okay, will be coming future. It will let our clinical practice more easy and more how to think, how to use the AI system is important. And also we also and hope and just like the AIS, the journal, give more discussion and more publish the different the AI the research and practice and open our surgeon mind and let the more the AI the product help us develop fast that the patient get the more benefit from it. And thank you all of you.
Thank you so much, and appreciate for everyone's presentation. And we hope the AI and metaverse experience in clinical and some taking space to have more benefits to the patients in their future. And we sincerely hope everyone could. Also consider artificial intelligence surgery journal as your first platform to publish your research works. And this our AS editorial office WeChat, and the next code is our website. So you can scan this code to aid me to realize more information about the journal. So thank you so much. So it's over to our amazing webinar. Hope you have a nice day and have a great gym.
Thank you. Thank you for the opportunity. And I would like to thank again whole
Sure.
editorial board of the journal, Artificial Intelligence Surgery Journal, because I think that is a very hard work in this topic, and also is one of the first of the journal dedicated to innovation in surgery. So thank you again. Thank you, Professor Mohammad Ansari, Yaxing, and thank you, my friend Andrew Gams, editor-in-chief of this fantastic journal.
Thank you so
Thank
much.
you, everyone. And what we are doing all is we are recording the history. This is a birth of history, a birth of a revolution. So I thank every scientist who is working to put his thumbprint in these advanced new science. So thank you for all. And I hope we can change something for better in medicine and surgery.
Thank you. Looking forward
Okay.
to seeing you again at our future AS events.
Have a nice
Bye,
day. Thank
bye.
you, professors.
Thank you.
I hope all of you be at our center in coming future.
Okay, okay. I hope.
We will arrange, Professor. Of course, we will be happy to visit the center and collaborate, and even to open a branch for our center with you, and to open a branch of your center with us. We can arrange that. We can exchange technologies, and of course, we will be proud.
Okay, thank you.
We hope in
Thank you.
future collaboration. Thank
Professor
you very
Michel,
much.
have a nice
Thank
day.
you.
And
Bye.
thank you.
Okay, bye.
Thank you. Bye bye.
Bye.